Welcome to Stay Alive and Fit with Liz Goodman, a new innovative radio show that taps into what's happening now in the medical industry, featuring fitness experts, foodies, and medical professionals from Tenet Health, with breaking medical news from David DePino. Get it right here and be an active participant in your health. Mixed messages about what is best for your health can make you feel like you're on a runaway train. So hop on and have some fun while Liz navigates this medical mystery ride. Call 888-565-1470 and ask Liz, your source for the latest medical technology and long life advice. All aboard. Here's Liz Goodman.
Get on the train. Get on the train with me. Hey, everybody. Happy Monday, Melanoma Monday. But it's actually not just Melanoma Monday. It's also Sleep Disorder Monday. We are going to be talking about some really interesting information about sleep apnea and all sorts of sleep issues. And we also are going to be talking about some really cool things about family medicine and family practices and taking things as a throwback to once was when doctors would actually care enough about coming to your home. Good evening, and I'm Liz Goodman, and you're listening to Stay Alive and Fit on WWNN 1470. If you want to call in tonight, you can call in and talk to us at 888-565-1470. That's 888-565-1470. I'm not a doctor or a nurse. The sight of blood makes me squeal. I'm just an ordinary gal trying to navigate through this crazy medical mystery maze with all the Obama craze and the marketplace and all this crazy stuff and figure out how I can stay fit, focused, and fabulous as I'm getting older and be able to take care of myself and learn the ways that I can do so. So what I do is every week I bring on some fabulous doctors. Sometimes I bring in nurses. Sometimes I bring in foodies. Sometimes I bring on fitness experts to talk with me and hopefully have you call in and ask Liz to ask these doctors some great questions. Whether you're 20 or 80, it doesn't really matter. As long as you want to be able to get personalized VIP medical attention from doctors, you call in, you email, you text, you write, whatever you have to do. I'm going to get the answers you seek right here Monday nights on WWNN 1470. Check us out on Facebook at www.stayaliveandfit.com is our website. And email me at liz@stayaliveandfit.com. Or again, call us at 888-565-1470. So tonight I have some really great doctors on the show. I've got a Dr. Bettini. Ooh, the New York came out of me there. I've got Dr. Bettini. He's from Florida Medical Center. Of course, he's with our wonderful Tenet Florida Physician Services. He's a neurologist, and he specializes in sleep apnea, among many other things. I also have, of course, David DePino. He's our breaking news specialist from Florida Physician Services. And I have Dr. Frank Snipes, like Wesley Snipes, not to forget that name, Dr. Frank Snipes. He's really fabulous doctor. He's been around for 28 years as a family physician, and what makes him so great is he's kind of left the practice, and now he's what you call like a floating doctor. He works for a lot of different organizations, but the one that I like best is the fact that he takes medicine very seriously. He's kind of disgruntled about the way things have been going in the industry with Obamacare and the access he's had to have to take patients, get them information, get their approvals, get them pharmaceuticals. It's all been a very difficult process since Obamacare has taken place. So what he did is he decided to go home to the patient and make it easier to access his patients and care deeply about those patients by coming straight to their door. And I'll let him talk to you all about what he's doing. In the meantime, I don't want you to forget, at 7:30 right after the break, we do have the American Cancer Society calling in with a great tip about melanoma, since it is Melanoma Mondays, and we always have our great oncologist. This doctor happens to be one of the doctors that's with Tenet Health, which is a sister company of Tenet Florida Physician Services. I'll give you his name after the break. You'll have to stay tuned and slip, slop, slap, and wrap, like I tell you every month. That's what the American Cancer Society wants you to remember before you go out in the sun. So I am going to kick it to David right now for a fabulous, I'm sure, great breaking medical news. Here we go, David.
Thank you, Liz, for having me, and those are very important topics, sleep and internal medicine, and then also, as you talked about melanoma, with the way the sun has been lately. Obviously, summer is right around the corner here in South Florida. It already feels like summer. A little breaking news, Tenet Florida Heart and Vascular Network and two of our heart experts, Dr. Brijeshwar Mani and Dr. Brian Bethay, have just embarked on a new research trial for severe aortic stenosis. And that is hardening of the arteries that goes on. And this is for patients that are considered higher extreme risk for aortic heart valve replacement surgery. The device that they're studying is fully repositional, which is important for the physicians if there is an issue in the positioning of a device, and it's retrievable prior to release. It's going to be studied by the clinical team of Dr. Bethay and Dr. Mani, as I mentioned. And again, it's heart valve research that focuses on aortic valve stenosis, the thickening and stiffening in the valve, resulting in a reduction of blood flow. And then last but not least, I'm working on getting my doctor on here, who's also an internist, Dr. Raul Perez Vasquez. He's here in Boca Raton. He's at West Boca Medical Center as well. And then a neurologist specializing in stroke, because May is Better Sleep Month, but it's also American Stroke Month. So we have a lot of important health observances this month.
Right, David. That's always interesting when you give us this really cool information. I don't really understand all the terminology of what you were talking about. So what was the first breaking news bit you mentioned?
Yep, it's a research trial for severe aortic stenosis.
What does that mean exactly?
Well, that's thickening of the and stiffening of the heart valves.
So does that cause stroke, heart attack? Or you probably don't know. I mean, I know you're not the doctor, but I just, I'm curious.
It causes reduction in blood flow to the heart, which obviously can lead to, a very cardiac issue.
Right.
Heart attack.
And so this month we're dealing with oncology and we're dealing with sleep issues. But I think that even if you have blockages of the heart, that can cause sleep issues and other things as well, probably, right? Maybe we can ask the doctor one of those questions.
They're the experts.
Exactly. So, David, tell me a little bit. We've got about 2 minutes before we have to go to break. We never really get the chance to talk about what Florida Physician Services are. Can you give me a breakdown so our listeners know what that means and what it is?
So we're an employed physician group. We're based across the counties of Miami-Dade, Broward, and Palm Beach. It's about 165 physicians. Tenet Florida Physician Services takes care of their real estate, their staffing, their PR and marketing. Pretty much the way I describe it is they put on a lab coat and they go to work. They're employed physicians. And then most of the time, about 90% of our physicians work in the 10 hospital network for Tenet Florida, which is 5 hospitals in Palm Beach County, 1 hospital in Broward County, and 4 in Miami-Dade County. Some of the ones you'd recognize around here in Palm Beach County is Delray Medical Center and St. Mary's Medical Center, 2 level 1 trauma centers. And then where Dr. Bettini is on staff is Florida Medical Center in Fort Lauderdale.
So the doctor's obviously been coming on the show a little bit now. What is the feedback? What is the feeling? Are they enjoying being here? Are they looking forward? Are you having doctors lining up? Like, give me a little bit about what's the buzz going on about this show. I mean, who wants to come on next? What's happening in June? A little bit stuff like that.
Well, to the first part of your question, I'll give a statistical answer. We onboard about 30 physicians a year right now, with about 5 leaving. So growth rate is about 25 a year right now.
Okay.
And second part of the question, I'm working on having a pediatric orthopedic surgeon on, which I think is very super specialized. And I really want to get a cardiac electrophysiologist on, which is an electrician of the heart that deals with heart arrhythmia or heart murmurs.
That's very interesting. So, but you're not answering me. Maybe I shouldn't keep on asking. What's the feedback with the show? Is this something they're looking forward to doing? Is it something you're still having to reach out for people to come on board? Just so we know, and you could be totally honest, what's working, what's not working, because I want my listeners to write in and I want to know what people feel.
The doctors are excited about it. I saw Dr. Bettini this week at the neuroscience symposium that we were talking about last week. And he was like, hey, David, I know that show's coming up. Let's get this started. And I'll tell you what, I had another doctor that wanted to come on tonight. So I technically had 2 doctors that wanted to come on the show tonight. Dr. Bettini got back to me first. So that's the way it works with me. And May is Better Sleep Month. So it just worked out perfectly.
Well, that's kind of why I was asking, because I knew there were a couple of doctors that I feel bad that we had to say, I'm sorry to tonight. And we're going to listen to them next month. But it's great. It's exciting that we're having multiple doctors wanting to join the program. And I know a couple of doctors we had on before are going to be coming back. Dr. Cohen is going to come back and give us some tips next month. And even though this month is melanoma month, all summer long, it's very important to watch what you're wearing.
Definitely in South Florida. And we had Dr. Abdullah was really excited about the way her show turned out. And the other doctors you have from the individual practice, I'm really interested in seeing what Dr. Frank Snipes brings to the program here. We just met in the lobby, very nice man, and he has obviously a lot of experience, 28 years.
I'm so sorry, David. I've got like some weird tickle in my throat. I'm borrowing your water.
No, that's fine. So yeah, the doctors are definitely excited about it. I've never had that happen where I've had two doctors want to get on the show at the same time. So that I can't ask for anything more. We've tackled a lot of topics, obviously, and neat thing about medicine right now in the PR terms is we have so many health observances. February is cardiology month. We have sleep month this month and stroke month. So we're really starting to get the word out on the great job that these doctors are doing in terms of, healthcare.
Thank you so much, and I apologize to our listeners. I don't know. They have the air conditioning blasting tonight, and something just got down my throat. So I apologize to listeners, but we are going to kick it to a commercial. I want to thank David DePino, of course, because he's always so informative. And coming up next, we have Dr. Bettini, the sleep genius master, enthusiasto, whatever you want to call him, an aficionado, enthusiast. I don't know. He's just a sleep doctor, and I can't wait to speak to him. See you in a minute.
Stay Alive and Fit is your weekly dose of information about health, wealth, fitness, or food so you can live longer, age gracefully, and stay alive and fit. Liz Goodman, she's your go-to gal to solve your medical mysteries. Mondays, 7 p.m. on WNN 1470.
Hi, I'm Liz, and ask me and I will find the answers you seek to all your fitness and medical questions. I'm not a doctor or a nurse. The sight of blood makes me squeal. I'm just an ordinary gal trying to navigate through the maze of all the ways I can stay fit, focused, and feel fabulous. Whether you're 20 or 80, male or female, mixed messages about what's best for your health can make you feel like you're on a runaway train. So get on board and take a medical mystery ride with me, and we will stop at every station to find the answers you seek. Call in to 888-565-1470 and participate in the conversation. Listen on Talk Radio WNN 1470 and watch us live on AMP2.tv. That's AMP, the number 2.tv. And don't forget to email me your questions to liz@stayaliveandfit.com, Mondays, 7 to 8 p.m.
So I think we're on the air. Yeah, there we are. So I apologize to my listeners. Live TV, live radio, things happen, and I just got a tickle in my throat and started choking there. So I apologize for that if it distracted the interview. But I am now going to be sitting here with Dr. Bettini. And his name is spelled a little bit strange for the pronunciation. I only say it because if you want to search him on the net, you actually can spell his name B-A-T, like bat, A-Y-N-E-H. B-A-T-A-Y-N-E-H. His name is Dr. Hassan Bettini. He's with Florida Medical Center. He's a Tenet Florida Physician Services physician. He practices at Florida Medical Center, which is located at 7225 North University Drive in Tamarack, Florida. He can be reached at 954-718-9777. That's 954-718-9777. If you'd like to call in and speak with the doctor live right now and ask him your sleep questions, it's 888-565-1470. And he specializes in sleep disorders and sleep studies, and he probably can tell us all the best things we have to do to cure our sleep apnea, determine if we have sleep apnea, and why it's absolutely necessary to take care of it and not just sleep on it. So I'm going to say hello and welcome to Dr. Bettini. How are you?
I'm good. Thank you, Les, for having me here and for this opportunity to talk about sleep in general and about sleep apnea.
Well, thank you so much for joining us. I'm going to stick that microphone a little bit closer to you. And I want to ask you a couple of quick questions. First of all, why don't you tell me very briefly what made you get into medicine? And then when you got into medicine, what was the driving force that made you decide that sleep was one of the areas of study that you wanted to focus your practice on?
Yes, I want to be a doctor to help people, of course. And why I chose sleep, actually during my residency, I took the sleep materials and I found it very exciting. So I decided to, and I noticed that people has a lot of sleep problems and they don't know about, or they just manage, they self-medicate. So it's important to see a professional for professional advice, and this is why I want to be a sleep specialist.
So just to, first of all, where's your accent from?
I'm from Jordan.
Jordan, okay. So sleep, medicating, sleep apnea. Just briefly, I mean, I know I read that 26% of Americans over the age 30 have sleep apnea. So give me an idea of what exactly causes sleep apnea and how somebody would determine. And I hear the phone ringing, so do we have a patient on the phone already? We have somebody on the phone, so let him hold off for 1 minute while I have you answer that question.
Okay. So sleep is a necessity, it's not a luxury. So the people look at sleep as something it's good to have, but actually it's necessary to have. It's like nutrition and other things, and it has good sleep will have good impact on somebody's health. So it's important to sleep well and to have normal sleep so that you stay healthy and to avoid all these diseases that might occur if you don't sleep well.
Well, what's the difference between just not sleeping well and sleep apnea? Like some people just don't sleep well.
Yes. So there are insomnia, which the people who do not sleep well, and some people who have sleep apnea. Sleep apnea is when they stop breathing during sleep. And it happens throughout the night. And that make them not sleeping well, and they have disrupted sleep. They keep waking up during the night because they stop breathing and they wake up, and that leads to low oxygen throughout the night. And when they wake up in the morning, they are not refreshed because they don't sleep the whole night. They have disrupted sleep. They think they slept the whole night, but actually they have disrupted sleep, so they wake up not refreshed. They want to sleep more. And during the day, they are sleepy and they have to take caffeine products or something to to help them staying awake.
So I have a text here from my producer saying that we have a caller on the line. His name is Mike, and he has insomnia, not sleep apnea. So, caller, are you there?
I'm here.
Hi, you're on the phone with Dr. Bettini. He's a sleep expert. He specializes in sleep apnea, but I'm sure he can tell the difference between insomnia and sleep apnea and advise you as to what can help, I think.
Yeah, I can tell the difference. My twin brother has apnea. He has a machine on his face. In any event, I've always heard that as you get older, the body stops producing melatonin at the same rate. And my question is, since my body must be producing it less, is it also harmful? Like I get up in the middle of the night sometimes and I look at the telephone and I look at the television and I see a light on. Does the light also reduce the melatonin and that it's harmful? Should I be sleeping in the dark?
Yes. So actually that's a good question. So as you said, once we get older, the melatonin production is less and less. And this is why the people with advanced age get insomnia more commonly than the young people because they don't produce melatonin as much. So the melatonin actually it's suppressed by light. So if you are exposed to light, the melatonin will be less. This is why during the night there is no light or less light, so the melatonin will be high and that make you sleepy. And the melatonin is the biologically clock hormone, and it senses when you need to sleep and when you need to be awake. So during the day there is light, and so the melatonin will be low, and that makes you awake and not sleepy.
So I see, caller, you had texted in that you had a question about taking sleep medications on a regular basis. What was it you wanted to know about that, caller?
Well, is there a way of weaning myself off? In other words, I take 2 Tylenol PM every night for the last 15, 20 years. And maybe once a month I take some sort of sleep aid that may be a prescription. At some point, they don't work anymore.
Yes. So insomnia, there are different causes of insomnia. And the way to go is to get professional advice and to see why the person has insomnia and to treat the underlying cause rather than just to take medications, because it's important to see why the patient has insomnia and to treat the underlying cause. And there are different causes of this. And again, I want to stress on the importance of healthy sleep, because healthy sleep means healthy life.
So when somebody has insomnia and they are self-medicating like that, I mean, number one, obviously he has to go speak to his doctor as to what's the underlying cause. But is there a way for him is there some method that you can suggest to start to wean yourself off that medication, or?
Yes. Of course, once we know what causes the insomnia, we need to treat the cause of the insomnia. And depends on what medication you take. You can wean yourself down. But Tylenol PM, you can just stop it right away because it does not cause withdrawal symptoms or any rebound effects.
Can you take sort of over-the-counter melanoma pills? Would that help you? I know there's herbal.
They've never helped me.
Never help you. Yes. Melatonin is a good. It does not make you sleepy, but it resets the biological clock. So if the cause, again, now talking about the underlying cause.
I'm sorry to interrupt, but what are some underlying causes that you could think of that would cause sleep insomnia?
So number one is sleep apnea. Sleep apnea is a very common medical condition. It affects 26% of the Americans over the age of 30. So it's one out of 4.
I didn't hear what first one was.
Sleep apnea is one of the number one causes for insomnia.
I don't have that. I'm not worried about that.
So what would be a second cause?
The second cause could be medications. Some of the medications cause insomnia. The other thing could be like behavioral, like anxiety or depression. Those are causes. Other causes, low melatonin. Like if the melatonin is low, you will have insomnia. And restless leg. When you
restless leg syndrome?
Restless leg is another cause of insomnia.
Interesting. Okay, caller, thank you so much for calling. I hope that answered your questions.
Wait, I think it's leading me into doing something else. Thank you very much and have a good night.
Thank you for calling.
Thank you.
Well, that's good. You helped him to decide to go do something else about it. Mm-hmm. I bet you most people would never think restless leg syndrome, which I don't even really know what that is, but that would be a cause of some serious sleep problems.
Yes.
What is restless leg?
So restless leg, it's very common, affects 7% of the Americans. So it's very common. And so this is when in the evening, when they're sitting down or when they're laying in bed, they have discomfort in the leg and they have the urge to move their leg. Because of this discomfort, they move it. And when they move it, they feel better. So they keep moving their legs. And that prevents them from falling asleep.
And keeps them up when they fall asleep and wakes them back up again.
Exactly. Yes, you're right.
So I know we'd like to talk about, we have about 5 minutes more, and I know you really want to get into why it's so important to treat sleep apnea. You were giving me some information prior to the show as to all of the different things that can happen to a person if they don't get proper sleep.
Yes. So again, sleep apnea is very common, and most of the people who have sleep apnea, they are not aware that they have sleep apnea. The symptoms of sleep apnea, they snore at night, and they wake up not refreshed, and they are sleepy during the day. Those are the symptoms. Some of the people, like when they wake up not refreshed, they are sleepy, they just drink coffee or tea to keep them awake. But
like a Band-Aid they put on.
Exactly. But this is not the way to go, because you mask the symptom,
right?
But you don't treat the disease. And it's most of the people do not are not aware that they have the disease. So it's important to make the diagnosis and to treat, because if we don't treat sleep apnea, it might cause a lot of complications such as high blood pressure, blood sugar, heart disease, heart attacks, heart failure, heart arrhythmias, dementia, memory loss, depression, chronic fatigue, and
wow, it's really very frightening if you don't get treated. So what I'm trying to tell my listeners is go see Dr. Bettini. Let him check you out. If you're not sleeping well, if you are being told by your spouse or your partner or your children that you snore, don't just assume it's normal to snore. Go see Dr. Bettini and give him a call at 954-718-9777 because you need to get tested. So if somebody came in to see you, what would be the method of testing?
Yes, so if the person has those symptoms and we suspect sleep apnea, they need to do an overnight sleep study in the lab. So they go to the lab and there will be a technician there. The only thing they need to do is to fall asleep. We record their sleep. And in the morning, they wake up and they go home or they can go to work. It's a regular night sleep. Then we record their sleep and it comes to me. I read the sleep study and will determine if they have sleep apnea or not.
And then once you diagnose it, what's the treatment?
So the treatment, it's very effective, which is called CPAP. CPAP stands for continuous pressure airway. Continuous positive airway pressure. So basically, in the sleep apnea patients, the airways collapse on each other and they stop breathing. So the CPAP is overcome this collapsing and it deliver high pressure. And again, 99% effective to treat and control sleep apnea.
Well, that's interesting. So is that uncomfortable for a patient? Is it comfortable? I mean, do they find immediate relief?
They might find immediate relief, but some people actually, I would say 50-50, don't feel comfortable wearing the CPAP initially, at the beginning. And we see this all the time, but we ask the patient, we educate them, we tell them the importance of using the CPAP to prevent those complications, heart diseases and high blood pressure. And after it depends on the person, but after a couple of weeks, most of the patient tolerate it well.
And then they see a huge difference in their life because they won't feel tired and need 20 cups of coffee anymore, correct?
Yes. So most of my patients, I get this all the time. CPAP changed my life.
Aw, isn't that wonderful? See, that must make you feel great.
Yes, it makes me feel great, and also for them because they like it so much, and they keep using it, and actually, when the patient come to me, to my clinic, with the CPAP, I ask him to bring the CPAP, so to educate them and to see how the CPAP doing. So the first thing they say, why did you ask me to bring the CPAP? I don't want you to take my CPAP away from me. I said, no, I'm not going to take it away from you.
Okay. So I have a Dr. Alice Cohen on the line. Or Dr. Alice on the line. No, not Dr. I don't have a headset on. I have Alice on the line. So we're going to take a call from Alice. We have Alice for the doctor.
Yes. I just wanted to ask, I met a guy.
Hi, Alice. I'm so sorry. I got you all messed up there. Speak up so we can hear you. You have a question for the doctor?
Oh, no, it's for the psychic.
Oh, no, that's a different show. This is not the show with the psychic. I apologize. We have a sleep doctor on the line. Would you like to ask a question about sleep? Okay, she's gone. That was funny. So we're here sitting here with Dr. Bettini. I want to say thank you to Dr. Bettini. I apologize for that. We have a psychic show prior to this one. If anybody would like to get in touch with Dr. Bettini, his telephone number is 954-718-9777. You got to give it to live radio, right? Just roll with it, guys. So we're going to take a quick break because when we come up after the break, we should have information from an oncologist from the American Cancer Society. And if not, if for some reason the wires got crossed, we will have our next guest, Dr. Snipes. Stay tuned.
Stay Alive and Fit is your weekly dose of information about health, wealth, fitness, or food so you can live longer, age gracefully, and stay alive and fit. Stay tuned. Liz will be right back. Don't turn that dial or you just might miss this week's Healthy Hot Tip. With Obamacare, it's almost impossible to get comprehensive medical care and information. What if you want to see an acupuncturist or chiropractor? No way, they won't pay. Need a specialist without waiting 3 weeks for a referral? Ask Liz. She provides VIP medical information for the masses. No referral, no marketplace, no hassle. Get on board and stay alive and fit with Liz Goodman. Mondays, 7 p.m. or watch live on amp2.tv and like us on Facebook.
Hey, everybody. We're welcome to Stay Alive and Fit. If you would like to get in touch with us, call us at 888-565-1470. And please email me at liz@stayaliveandfit.com. Like us on Facebook. And check us out on the web at www.stayaliveandfit.com. Right now, we have Dr. Michael Casper. He's an oncologist. And he served on the local division and national boards of the American Cancer Society, as well as the ACS National Puerto Rican divisions of the ACS. He's been a leading advocate for improving cancer care throughout the state by increasing research capacity and raising treatment standards. His advocacy work is at a state level, was instrumental in the passage of Amendment 6, which is giving Florida workplaces smoke-free zones, and we love that. But his specialty right now is giving us a tip from the American Cancer Society on how to stay protected for the sun throughout the year. Dr. Casper, welcome to the show. Thank you so much for coming on.
Thank you, Liz. It's my pleasure to be here.
Do you want to give out a quick telephone number if people ever want to get in touch with you and where you're working right now?
Sure. I'm at the Lynn Cancer Institute at Boca Raton Regional Hospital, and we could be reached at 561-955-4111.
And Dr. Casper, I hear that you're also part of the Tenet Health Group, right?
Yes, we are at Delray Medical Center and also West Boca Medical Center.
Okay, wonderful. So, I do this segment every Monday because we're doing Melanoma Mondays, and throughout the summer we're going to be focusing on how to stay protected from the sun. I don't know if you've seen my show at all, but I'm very fair. My children are fair. My grandfather had skin cancer, and my stepfather is always having these things removed from his head, regularly. And it scares me about my blonde-haired, blue-eyed little boy and girl, what can happen to them and how I can keep them protected. So, it's a frightening thing. I know melanoma is metastasizes, and people just don't take it seriously. So as an oncologist, can you give me some really quick tips on how people can donate to American Cancer Society?
Absolutely. Well, you hit the nail on the head. There are some genetic high-risk factors, so blonde or red hair, blue, green, or gray eyes, fair skin. Those all put you at higher risk for developing sun damage to your skin. So it's important to know your skin type and really, most importantly, play it safe. We know a lot about sunscreen, and I think most people know to choose SPF 15 or more. Use a broad-spectrum sunscreen, which protects against UVA and UVB rays. Most people, I think, at this point do understand that it's the UVA and the UVB rays that are causing the damage and causing the sunburns. So go ahead. I'm sorry.
No, I was going to say, so is it true that if you wear the sunscreen and you get a suntan, it's okay as long as you don't get a sunburn?
No, suntan is your body's attempt at protecting you against long-term damage, but that damage is occurring with the tan as well. So you're setting yourself up for wrinkles and damage to your skin that frequently shows up 20, 30, 40 years later.
So, like, I know yesterday I had a pool party for my kid, and it was his 9th birthday, and my daughter got sunburned, and I sent her to the school today. She's 10 with sunscreen. I said, please put it on before you go outside because you got a little sunburned. And even though we were putting on the sunscreen every 20 minutes or so, we were only at the pool party for an hour and a half. Both my kids got fried. I mean, it's just, what can you do, honestly? I mean, I lathered, slapped the whole thing, and they still went to school with sunburns and their face hurting.
Sometimes it's difficult. Sometimes sunscreen can spoil. Make sure that it's not sitting around for a season or two. You need to replace it occasionally.
I buy it brand new every season. I really do. And it's still, I mean, I just don't know. I don't know what you can do here in Florida to stay safe.
Well, one of the things you can do is first make sure you use enough. You need to, on average, should use about the size of a large grape to cover your face, ears, and neck every time you put it on. And also, the best protection is sun-safe clothing. Clothing can block 100% of the UV rays, so you should try to wear clothing, if possible, that covers a large amount of your skin. And use a clothing with a tight weave. It can be light and loose, but it needs to have a tight weave that allows little or no light to pass through.
Okay, Dr. Casper, thank you so much. Give a shout-out to the American Cancer Society providing Dr. Casper here. Dr. Casper, I'd love to have you on the show one day if you'd like to join us. I'll give your office a call. You'll let me know. I think we'd have a lot to talk about. And thank you so much. Is there any last words that you'd like to state for the American Cancer Society?
Well, one of the Austrian Radiation Nuclear Protection says reapply regularly, but remember that reapplication only keeps the protection for the first application. So if you're reapplying, it doesn't mean you get another 2 hours on top of that. You've already used up that 2 hours. So, staying out of the sun and covering up is your best protection.
Thank you so much, Doctor. I really appreciate the call. Have a wonderful evening.
My pleasure. Thanks.
Is Dr. Cohn still on the line? Yeah, we also have Dr. Cohn on the line. How are you, Dr. Cohn?
Hey, Liz, how are you?
Good. We just had a quick interview with Dr. Casper. He's another oncologist with Tenet Health, and he was giving us information for the American Cancer Society, but I know I love having you on the show. I get some Casey's tips, right?
Yes, you do. I really like Dr. Casper's tips, too. I thought they were really good.
So can you add anything to it this month?
Sure. I think that everybody needs to establish their own skincare or application of sunscreen regimen. So if you get into a regular routine. So like for me, example, you need to really apply sunscreen 30 minutes before you even hit the sun for it to absorb. So if your kids were out at the pool party this weekend and you actually applied the sunscreen while they were out in the sun, it's too late. They're not going to get any protection for at least another 15, 20 minutes. So one of the things I do, especially if I go on a beach trip or I'm out with my family, is that while I'm indoors, as soon as I wake up, I just start head to toe. I establish, I do my head to toe regimen, and I let it soak in. Once I've put my sunscreen on, then I'll go and have my morning coffee, and I know that I'm good. And then, just like Dr. Casper was saying, that reapplication, if you can get out of the sun for another 30 minutes, let the sunscreen re-soak in again, then you'll have better protection. And then if you're just completely white like I am, then protect, especially if you're going to be out on the boat or, on the water, then I think that protective clothing is definitely that added layer of protection.
Well, next week when we have a chance to talk again at greater length, I do want to touch on the fact that two things, and we can think about this, is, my kids were in sun-blocked clothing. They had the UV bathing suits on, and it's their faces that got burned, and I did put it on a half an hour before. Sometimes you just can't help it, I think. But the thinking that I have that I would like to discuss with you is, what about putting this on all day long, and what are the ramifications about putting on this? I feel like, are we putting poison on our skin all day long? I mean, there's that sort of that catch-22, right? You're blocking the sun, but you're also putting a chemical in your skin. And I don't want to talk about this tonight because we have another guest here tonight, but I'd like you to, come back to me next week with some interesting topics on, parents like me who are very nervous about putting all that stuff on our children.
Of course, I'll be happy to do that.
Okay, Casey, do you have a quick tip for us?
I think the sunscreen set regimen is definitely my quick tip for tonight. Is to establish your own sunscreen regimen and just stick to it head to toe.
Head to toe. I think that's the tip of the night. Head to toe, head to toe.
Head to toe.
Thanks, Casey. Thanks for joining us tonight.
Problem.
Dr. Cohen, do you want to tell
Liz.
people your telephone number if anybody wants to get in touch with you?
Sure. My phone number at the office is 305-820-6657.
Okay, thanks so much, caller. We're going to take a very quick break, and then we're going to come back with our Dr. Snipes, the doctor on the go, mobile doctor right to your door.
After the break, our healthy hot topic of the week. Stay tuned to AM 1470 WNN. You're listening to Stay Alive and Fit with Liz Goodman. In today's world, only the elite receive the very best care or advice. Stay Alive and Fit with Liz Goodman is like VIP MD for the masses. Ask Liz medical and fitness questions live on the air. Call us at 888-565-1470 and tell us what you want to learn more about. Tune in for a sneak peek each week from David DePino, PR specialist for Tenet Florida Physician Services, a division of Tenet Health. Dave will tell you breaking medical news prior to its release. Hear it first on Stay Alive and Fit before it hits the presses. So listen for 60 minutes or miss it in a minute. Mondays on Talk Radio WNN 1470 or watch us on amp2.tv.
Welcome back to the train, and welcome back to Stay Alive and Stay Fit with Liz Goodman. I'm your host. If you'd like to get in touch with us, you can give us a call at 888-565-1470. Check us out on Facebook, Instagram, and on our website at www.stayaliveandfit.com. And don't forget to email me your questions at liz@stayaliveandfit.com. So right now, I'm very excited to introduce to you Dr. Frank Snipes. Let me put on these old lady glasses I got here. Dr. Snipes. He's a family physician and internist for 28 years. He cares really deeply about helping people. I've been speaking to him a lot over the last week to learn about him. He's really passionate for what he does. He's a family doctor. He works for the Center for Family and Child Enrichment, which is located at 1826 Northwest 167th Street in Miami Gardens. He also works for the Hollywood Hormonal Therapy Center, and they can be reached at 954-533-2012. And he also works for a mobile company called Mobile Doctor Services. His telephone number there is 561-352-3565. The telephone number for the Family and Child Enrichment Center is 305-474-1800. So there's a lot of different ways that you can get in touch with Dr. Snipes. What's so interesting to me about Dr. Snipes, and we talked about a great deal about his, I guess, being a little bit disgruntled with how Obamacare has made it very difficult for his patients to be able to just easily get prescriptions. He has to go through this whole process, which is frustrating for him. And sometimes he can't even see his patients anymore just because of the way the insurance plays out. So he is very passionate about still being able to help people. So he belongs to this mobile program where he can actually go to people's homes and help them. And I don't exactly know how it works, but I feel like it's a throwback to when we were kids, or when I was a kid, and you'd get very sick and a doctor would come to the house. Now they just make you go to the ER. So it's a very different time period. So welcome, Dr. Snipes.
Thank you very much.
So give me a little bit about your background, and you have a lot of different companies that you work for. How did that all come about? And tell me a little bit about your passions.
Basically, I was working for an internal medicine clinic for 3 years, and because of the frustrations you were talking about, I just got to a point where I just had pretty much had it.
Mm-hmm.
And so essentially, I'm out on my own, basically, and I have found a niche in the past which started accidentally. I was looking for a moonlighting opportunity. I found a job in the Davie area that basically went to their homes.
Mm-hmm.
I did that for every 2 or 3 Saturdays a month, and found a real passion for doing that. And that's almost a ministry, really. I mean, the people they're forgotten. I mean, that's the headline, the forgotten of patients out there.
What does that mean exactly, this mobile care? Are they uninsured patients that just pay you separately, or are they donated patients? How does that work? I mean,
primarily, a lot of them are Medicare. There are some Medicaid.
Mm-hmm.
People who have insurance, basically, can still be seen. We provide them a a voucher or information, an invoice as such, that they can deal with their own insurance companies to get reimbursed. But a lot of people particularly don't want to go to an office. They don't want to take off, like CEOs or people in businesses and such that don't want to even necessarily go to an office and sit in the lobby for a long time and be coughed on.
So is it a VIP service? You have to have a lot of money for it, or is it, affordable that anybody can sort of tap into it?
Anybody can tap into it. And basically, this is an example. I gave you an example of one of the things that was phenomenal. A lady I saw that basically met us at the door with a tremendously painful left hip. And, you ask these people, how long has it been going on? It had been going on for months. So we got her an orthopedic surgeon. She had her hip replaced, and she's doing beautiful. So there are a lot of people that, I guess I would divide it into the two, the VIP types that don't want to go to an office, don't want to sit, don't want to take the time off. At the same time, patients that are at home and they are absolutely lost. They're homebound. They don't necessarily have access to a church or a synagogue or whatever their faith-based is. They don't many have sometimes friends. Neighbors may or may not be helpful. Relatives could be scant. And they kind of get ignored.
So a patient finds the mobile service and they call you up. And what's the process? Do you just show up at their door? Do they have to fill out all the paperwork? Do you have to get referrals? How does it exactly work?
Actually, from my standpoint, I'm happily ignorant of a lot of that. Basically, what they do is they call the number, and the individuals on the other end take care of all that. They tell me where to go and where to see them, what their address is. I call them. I tell them I'll be there within such and such a time. And it works out very well.
Do you have any idea what the cost is for something like this?
Roughly, I would guess $150.
It's
roughly.
really reasonable. So
It's
come to your
very
house for
reasonable.
$150 and you can have a doctor check you out.
You can. And essentially, getting back to the people that I guess my heart is for, the people that are the lost, the people that have not gotten connected and interfaced with the system. And you can go out and get physical therapy. You can get specialty care, such as our initial guest that you just talked about, the sleep apnea. Case management. You also get to see what their home environment is, how neglectful it is. Do they have water? Do they have lights? Do they have electricity? Is it a safe environment? I went into one patient's home and there was nobody around and he was homebound in bed. If the house burned, he was in major trouble. So we got home health involved with that and case management and such, and that turned around.
So are they coming in to see? So if I don't feel well and I want to see a doctor, is it just I'm calling you up because I've been coughing and I maybe think I have the flu, or is it because I need my annual physical? Like, what would be the reason that I would call a mobile doctor in this day and age?
Pretty much anything. You could do, we've had both. Most of the time they don't call for a physical as such. Most of the time it's an illness or some problem. A lot of people come in from out of town. We've seen people from Brazil. I saw a few last weekend from Brazil, and fortunately found an interpreter. But basically I'd have been a bit lost. But they came from out of state, obviously out of the country, and one of the individuals was having a problem. It was a minor one, but without somebody taking care of it. And it's a lot cheaper than going to an emergency room or a facility where it's horribly expensive.
Okay, so let me ask you a couple questions about this hormone company you work for. So what does that mean, hormone therapy? Is it for men, for women? Is that a clinic type place, or do you have to have insurance for that? How does that work?
That's primarily cash, essentially. It's a clinic in Davie. I started working for them a few months ago when I left the private practice. It's primarily for men, although women certainly are there as well. And at the same time, they do vitamin therapy. They do things that are really, as an internist and being trained in the 80s, we never were taught that sort of thing. You know, vitamin D was in milk, and go out and get some sun, and there's your vitamin D.
Now they tell you to stay away from the sun.
Now they tell away, so we're in a dither. So yeah, it's basically it was very primitive when I went through it, and so it's gotten a lot more advanced. Things like glutathione and such, things that I never dreamed about really in medical school or residency, and now has become one of the focal biochemicals of cell metabolism, CoQ10, that sort of thing, which has been popular for a few years. And then there are a lot of men that are low on testosterone. I can't tell you how many men think they're just old, and they're not. They're basically low on testosterone or maybe low on vitamin D and so on and so forth.
Right, like women when they're going through menopause. It's the
Absolutely.
same idea. But you think hormone therapy, you think for a woman who's an estrogen replacement, but it's actually more geared towards men.
The particular clinic I'm in, yes.
So then you work for the, wow, you are a busy doctor. Do you have anything?
I live in a phone booth, I'll tell you.
Do you have any personal life at all, Doc?
No, I tell you. Live under the bridge.
You work for the Center for Family and Child Enrichment. So what does that mean, child enrichment?
Basically, that's a federally funded, it's a not-profit or non-profit organization that's been around since 1977. It started out as a behavioral health, and then they added on different groups like pediatrics, and eventually they've recently added dentistry. I was the newest caboose on the train. I was the added internal medicine.
I love that you use the train metaphor. You know this show is all about hopping on my train.
That's true.
So you are now the newest caboose on this train,
I know.
too.
Make a poster, yeah. But essentially that was the issue. And I joined them when I left the private practice, and it's been fun in terms of marketing for that place because they need to build up their internal medicine aspects. So we've been visiting hospitals and such and trying to get them patient care. Because as I was at Hot 105 about 2 weeks ago advertising that, and people don't know that they sometimes have these illnesses, just like the previous guests as far as sleep apnea. They don't realize they've got hypertension or diabetes or thyroid problems or whatever.
So I guess what I would like to know, and I'm sure a lot of listeners would like to know, what exactly is an internist? When you're picking your primary care physician, I know for whatever reason, maybe because I've had like GI issues, I always go for an internist. But not every family primary care physician is an internist. I'm always thinking, well, I'm going to go for the internist. Is that what most people should do when that's their primary care? Is that the best choice?
Not necessarily. Family practice is a whole specialty. In fact, I did a residency of that in Pensacola. And when I got finished with that, to answer your question indirectly, I wanted to be an internist because I wanted to see sicker people, and I really didn't want to see children so much and pregnant women and so on. So I was more interested in critical care and that sort of thing. So I went to St. Louis and did another residency there. But to answer your question, either one. I mean, family physicians do a tremendous job, and they're more expanded as far as children and so on and so forth. Internists are...
Yeah, I know a lot of people, though, when they have to choose who their regular primary care is, they choose internists. Is there a reason behind that?
Personally, I think if somebody is older, they have more multiple complex illnesses, this is my own opinion, I think internal medicine is more, maybe more intense for that sort of thing.
So what is just a family physician, what is the specialty in family physicians versus internal medicine?
Well, they really do a broad spectrum. I mean, they do kind of a broad paintbrush of everything. They do internal medicine. Years ago they did surgery, but they really don't do that much anymore. They certainly see children. They certainly see pregnant women. Some do, some don't. It's a more broad general practice, Marcus Welby, if you will, kind of approach. And
I like your metaphors.
Well, thank you. I probably OD'd on it. That's why I became a doctor. But so basically that was the issue, and internal medicine is more focused on.
And where is that accent from?
Mississippi and St. Louis.
Okay, and so did you go to university there?
I went to University of Missouri in Kansas City. It was a school outside of high school. It was graduate high school and went right into it for 6 years. And it was good from the standpoint that you got done earlier. It was bad from the standpoint that you didn't have the usual spring break and, that kind of thing. So I still feel kind of pinned up at times. Never got that out of my system. But other than that, it was a good school. I went to a residency in Pensacola, did it for family practice, and then went to St. Louis and did another residency there for internal medicine.
And I saw that you were a chief resident on your resume. So what does that mean to be the chief resident?
It's just kind of an honor. Basically, actually at the time that I did that, there were 2 or 3 of us. We divided it in a year. Usually the last year of your residency program, they usually have a chief residency, which really just is a kind of a supervisory of the other residents and so on. So
does that mean it's because you were the best resident?
Well, maybe
come on, be modest.
I don't know. I mean, I liked it. To be honest, some of the best years of my life were in residency because, you were doing what you wanted to do. You weren't dealing with co-pays and prior authorizations and all the things you were just talking about. You were just dealing with learning what you wanted to do.
Well, I think that brings us full circle because we only have a few minutes left. And I know when we've spoken quite often in the past week or so about your passion for helping people, and we haven't been able to spend a lot of time on this show, but I'd like to invite you back for another show.
Would love it.
Where we can talk about Obamacare, how it's changed medicine, how it's changed your practice of medicine, and why you're really focusing on being like a doctor on the go and working for a variety of different companies instead of having one main practice. Is it because of the accessibility? Is it because of the bureaucracy? Or is it because of the passion? Or is it because of all three?
Probably all three. I'm just sort of experiencing a new envelope right now. And I would like to get more into radio, as you and I have spoken, because I think that's a medium that could really help people, such as the people you've called in earlier. And I think that would be a great way to access people, because I think there's a tremendous need, and people are starving for people who will listen and really try to touch their heart. And I think that's a big need. And I think the world of technology has been counterproductive in that.
So your passion is for people.
It really is.
And your passion is to help people. And what we're going to do is we're going to bring you back on the show, and we're going to try to arrange, a lot of social media out there, and let people know that it's an opportunity to ask questions to a doctor who really cares, who will come to your home to help you.
Sure,
for
particularly Beverly Hills. Yeah, Beverly Hills, yeah.
I mean, that's like nothing under right. Less than a couple $100 to have a doctor come right to your door. I think that's just unbelievable.
Well, I think it is.
So you have 3 numbers here. I'm going to give them all out very quickly so people can get in touch with you. If they want to find out, see the doctor at the Center for Family and Child Enrichment, they should contact him at 305-474-1800. At his mobile doctor services, which is my favorite of these 3, because I feel like that's the passion right now, where you can just go home to somebody's house and help people right at their doorstep. That's 561-352-3565. And the Hollywood hormone therapy for all you men out there who need a little boost of testosterone. That's 954-533-2012. I want to thank Dr. Snipes for coming on the show. I want to thank all of my guests. American Cancer Society for sending us a great oncologist to speak with us. Dr. Michael Casper. I have Dr. Bettini with Tenet Health, or Tenet Florida Physician Services. And next week, we have some interesting doctors coming on the show. Stay tuned to our website and Facebook page to learn more about who's coming on the show next week. Please call us, email us, get involved, participate. We're here to help you to answer your questions. That's the whole point. If you don't call and write in, we can't give you the answers you seek. Welcome, thank you, and see you next week.
Thank you.
You've been listening to Stay Alive and Fit with Liz Goodman, a new innovative radio show that taps into what's happening now in the medical industry, featuring fitness experts, foodies, and medical professionals from Tenet Health, with breaking medical news from David DePino. Get it right here and be an active participant in your health. Mixed messages about what is best for your health can make you feel like you're on a runaway train. Get ready to hop aboard again next time for Stay Alive and Fit with Liz Goodman.